Bipolar disorder is a serious condition that affects approximately 4 of every 100 adults at some point in their lifetime. Symptoms include periods of sudden and extreme change in emotion and behaviors known as mood episodes. These episodes can vary in length, type, and intensity. No definitive cause has been identified for this disorder, but children with close family members that have bipolar disorder are more likely to develop it than children who have no family history of the disease. Because of this, genetics is considered a risk factor for developing bipolar disorder, but it is not the only one. In studies of twins, it was found possible for only one twin to develop the disorder, indicating other possible factors. Fetal development that impacts the structure of the brain, as well as environmental factors such as external stressors, can also affect an individual's likelihood to develop this disorder. At least 25 different genetic variations have been found to affect the expression of bipolar disorder. Tryptophan hydroxylase 2, or the TPH2 gene, is the most commonly affected and has been shown to have a high correlation with bipolar disorder. A 2008 study found a strong correlation with an odds ratio of 4.8 between bipolar disorder and 3 different SNPs in the TPH2 gene. TPH2 codes for an enzyme that controls the production of serotonin. It has been shown that lower serotonin production is consistent with the depressive phases of bipolar disorder. Because of this, our SNP chip test will target the TPH2 gene to discover whether or not an individual has either the RS111788997 or the RS1711056 SNPs, which are the two most commonly found in individuals with bipolar disorder. On average, 4% of adults can be diagnosed with bipolar disorder at some point in their life, but if a person has either of these two SNPs, that number increases to 70%. Our test can be incredibly useful for people with family histories of bipolar disorder that are curious about their own risk. This can give them the opportunity to create a health care plan. But remember, the findings of these SNPs does not have a 100% correlation with bipolar disorder. Having a specific variation does not guarantee you will develop bipolar disorder. Psychologists also argue that for some patients, a positive diagnosis from pre-symptomatic testing can lead to worsening symptoms of depression and anxiety. We urge you to consider your personal situation carefully before participating in any testing.